It's a momentous week in Georgia, Washington, and these United States. In this special episode of the HealthBiz podcast, Bloomberg Intelligence Analyst Rye and I and I discuss the health policy implications of the 50+1 Democratic Senate majority. Listen as we discuss drug pricing, Medicare Advantage, and the public option. I'm your host, David Williams. Thanks for tuning in, and remember to subscribe to HealthBiz. Brian, thanks for joining me today.
My pleasure. Thanks for having me.
Well, Brian, it's a big day today in many ways. I guess we'll find out just how big in the coming hours. But just to start off, want to hear about what's your background and what's your role?
Sure. Thanks again for having me. I'm the healthcare policy analyst with Bloomberg Intelligence. We're the research service for the Bloomberg terminal and Bloomberg subscribers. I've been with Bloomberg Intelligence for about 6 years now. Prior to this, I was on the sell side, a number of firms, SunTrust, Raymond James, Janney Montgomery Scott, covering various healthcare companies, primarily biotech and pharma.
Great. Well, there's a lot to talk about in healthcare. Now, you put out a white paper and you had several assertions related to the Georgia election and if it means control of the Senate or effective control by the Democrats. And I'll just go through some of the points. So first thing that you said was that Georgia eliminated pharma's Senate firewall. And what do you mean by pharma having a firewall in the Senate?
Sure. Well, over the past couple of years, the House of Representatives, which is controlled by the Democrats, they passed a number of bills vehemently opposed by the pharmaceutical sector, giving the government the ability to, depending on your point of view, either negotiate or dictate prices in the Medicare Part D program, as an example. And those have all died in the Senate. Not that they've been voted down in the Senate, they've never even got to that point. Senate leadership from the Republican side has simply ignored them. And so Mitch McConnell, the Senate Majority Leader, has taken the stance that he does not view that as good policy and so is not going to give that even the time of day, not going to let his committees process those bills, certainly not let them get to the floor for a vote. If the results that we've seen so far in Georgia hold up and it's a so-called 50+1 majority for Democrats, and all of a sudden Chuck Schumer is the Senate Majority Leader, then maybe that calculus changes a little bit in terms of which bills could actually get to the floor and get considered. And I think that's the end result. Not that there's a huge difference in the total votes between 51 to 49 or 50 to 50, but that gatekeeper, that firewall, as I termed it, is important, I think.
You're pointing to something that's clearly important for a lot of different areas in the McConnell era, which we've been in for 6 years. A lot of things just never come up for consideration. And I'll just tweak it a little bit more with my words. I would say it's kind of like a fire break. It's like it never even gets across. So the senators never have to do anything. It's like the chasm between the House and the Senate.
It's a Grand Canyon style ditch.
Yeah, no, that sounds good. All right, so you also say that drug makers are gutted and insurers are aided by the Democrats' 2021 roadmap bill. I wonder if gutted is too strong of a word. And what do you mean by that? And let's break it down because there's a lot of different elements of the pharmaceutical industry.
Yeah, and again, to be clear, this is not something that has been enacted, but this was a bill that the Democrats passed actually a couple of different times. The most recent iteration was back at the end of June of 2020. And when I say gutted for pharma, we do a couple of things. Number one, would start the process, actually would give the government the ability to negotiate prices directly with drug makers in the Medicare Part D program. That right now is prohibited by law. The 2003 Medicare Modernization Act specifically prohibits the government from interfering in price negotiations between pharma and insurers. That's long been sort of the holy grail for Democrats on the drug pricing front, was to repeal that so-called non-interference clause. And in addition to that, sort of a, not a carrot, but more of a stick, if companies were either unable or unwilling to enter into negotiations with the government in that scenario, they would face an excise tax of 65% of gross sales, growing 5% each quarter up to I think a top of 95%. So again, as things have stood over the past 6 years with McConnell leading the Senate, that was dead on arrival. But now, potentially with Chuck Schumer, allowing those votes to maybe come to the to the Senate floor raises some questions. And so that's sort of what I meant by gutted is, that's the CBO, the Congressional Budget Office, said that would probably reduce Medicare drug spending by about $450 billion over 10 years. That's real money. That's something that I think would catch the attention of a lot of folks. It would call into question the very viability, I think, of the current business model for a lot of PBMs and insurers. And honestly, it's for that reason that you've seen not only pushback from pharma on this front, but also the insurers and the PBMs. They don't want the government involved in this, and so that's sort of been the hurdle. From a lobbying standpoint, that hurdle still exists. But if it's Schumer instead of McConnell, that's one step closer to getting something like that on the floor.
It'd be interesting to see how things evolve now with the new administration and also with the reality of the coronavirus pandemic. On the one hand, you can see there's a need to push and to save the money. And you say 450 billion sounds like a lot of money. To me, it sounds like half of a stripped down stimulus bill for 1 year. So everything changes, over time. But also, I think there's been, some of us in the industry, I'll put myself there, are not opposed to, high drug prices in general if it's for something that's new and innovative. And I don't mind that someone's paying $2 or $3 million for gene therapy if it's a real breakthrough and a cure. I think the issue has been with some things that are really a Me Too product or kind of abuse of the orphan drug laws or that kind of thing. And I wonder if we'll see with the real innovation that's occurred on the vaccine development and also for things like the monoclonal antibody cocktails for treatment of COVID-19, whether there'll be a more nuanced view and we can tease some of that out.
Yeah, I think there probably will be. And again, it's 50 to 50. This is the current election results have gotten the Democrats a little bit closer to the goal. I'm really not convinced they're going to get all the way there. And I think you're right. As a fallback, there are some things where there's some conceptual agreement between the two parties on either some unintended consequences of orphan drug designations, or I think there's a willingness on both the part of Republicans and Democrats to give seniors an out-of-pocket cap in the Part D program, restructure that, get rid of the so-called donut hole in there that I know a lot of insulin manufacturers have been hammered by. So there are things they can do well short of this more draconian step that the progressive Democrats have favored. So the other aspect of it, though, from the Democrat standpoint, is what they like to do is, $450 billion, not a big deal in the grand scheme of things, but they can then sort of take that as an excuse to then pay for expanded Medicare benefits on the other front. They want to have a new dental benefit, vision benefit, a lot of other hearing aids that aren't currently covered under Medicare, and use this as an umbrella to help pay for that. So that's how they'll likely try and pitch it. But again, there's a lot of things the Democrats want to do, and only so many days in the year for them to do it.
I'm glad you mentioned hearing aids because we always want more podcast listeners. So I'd be in favor of regulating the drug industry if it means that. Let's talk about this government negotiating the drug prices for Medicare. So on the one hand, the federal government is a strong negotiator. They've got all the purchasing power and all the resources and so on. You can understand why neither the insurers nor the drug companies want the government involved because then it's sort of less role for them. But how effective are the feds really as negotiators? I mean, they can't necessarily walk away from the table and say, we just won't cover that drug the way you would see it happen, let's say, in some European countries. And I wonder how effective are they really as negotiators compared to, let's say, the PBMs?
I would argue, and it's something that we may or may not ever see, but a smaller scale sort of experiment is looking at the VA, the Department of Veterans Affairs, where they do have closed formularies, do have much lower prices. The downside of that is, back to your earlier comment on innovation, is because of that, there are a number of, especially the newer biologics that our veterans don't have access to. And so maybe a third, 40% of veterans have to have a separate VA, a separate Part D plan or some other drug coverage to get access to the drugs that their own VA formulary doesn't cover. And so, that's the problem, is that is a trade-off. And the COVID pandemic has certainly, I don't think the drug industry wanted this to happen, but it is reinforcing their big argument that if you want innovation, and my goodness, everybody wants innovation more than anything right now on the pharmaceutical front and vaccines as well. You want to do that, then maybe price controls aren't the way you want to go. So with that, in sort of their mind, the onus is now on the industry to kind of deliver on that and make sure that, you don't have any bad actors on the COVID front taking advantage of the situation either.
When the Affordable Care Act was passed, there was this idea of a public option, which is something that I liked because the idea was, you have health insurers that nobody really likes to deal with their health insurance company, including me, and probably people who work for health insurance companies don't like dealing with their health insurer. And the idea of a public option is, well, let a public version compete and see how it does, and it may sharpen the pencil of those insurers. And instead, we got this co-op program that was kind of doomed to failure, or at least did fail. And now there's talk in Biden care of bringing a public option back, although it's in a way that wasn't originally intended, but more of a kind of a workaround for states that didn't expand Medicaid. Can you talk about this, public option?
Yeah, it is something that President-elect Biden has put in his healthcare platform. I would say it's not included in things that Speaker Pelosi has put forth from a congressional standpoint. So there's some things there. And going back 10 years, I know a lot's changed in the past decade, but when the ACA was passed, the true public option, as you mentioned, was kind of left on the cutting room floor. That it was considered to be a bit too extreme. Even when Democrats had massive majorities in both the House and the Senate back then. So remains to be seen what they can actually get across the table. But the idea is, at the time when they passed the ACA, the Medicaid expansion was thought to have been, kind of forced, required for all states. The 2012 Supreme Court decision made it optional, and we still have about 14 states, I think, that have not yet expanded Medicaid. So my guess is the compromise here is going to be some combination of carrots and sticks to try and get those holdout states to expand, either through guaranteeing them 100% match on the Medicaid, spending for 3 or 4 years. Maybe penalizing those that don't with lower base rates. So I'm not sure what they'll come up with. Certainly, the HHS nominee, Javier Becerra, has been leading the legal defense of the ACA in the Supreme Court. So he's quite familiar with the various levers that can be pulled. And I would expect from his standpoint on a regulatory basis that maybe rolling back some of the ACA actions undertaken by the Trump administration, looking to expand and protect ways they can work with a narrowly divided both Senate and, given that Pelosi lost a number of her members on the Democrat side as well in the House, they've got a smaller majority there. So it's probably going to be more of a centrist view in terms of what can get across. But yeah, by all means, the Democrats have the chance they've been looking for to both roll back some of the Trump actions and maybe even expand the ACA's reach going forward.
There was a lot of discussion in the Democratic primaries about so-called Medicare for all, which had different definitions over time, and Biden never really embraced that. But he has talked about things like lowering the age of eligibility for Medicare, and we've also seen, while there hasn't been any sort of Medicare for all or socialism, there has been a big use of Medicare Advantage over the past few years. And how do you see those two things interacting? Is it likely that we're going to see a Medicare expansion and possibly to people that are a bit younger than the current 65?
Yeah, I think that is, again, a more moderate version of the Medicare for all, Medicare for more kind of approach. And I think Vice President-elect Harris even mentioned that specifically in the one VP debate that was held, that maybe lowering that age down to 60. Well, officially, the true Medicare eligibility age remains 65, but allowing those maybe down to 60 to buy into the program if they desire, because you get that 62, 63-year-old individual, maybe they're not employed, they're on the ACA individual marketplace, that's a pocket where it's not really a good deal financially, hasn't been a good deal financially for them. And so if you give them the option, perhaps of taking Medicare, they might accept that. I expect that as part of any program like that, it won't just be fee for service, that they will allow Medicare Advantage to be an option. So from the standpoint of, United Health, Humana, any of the managed care companies, you're sort of robbing Peter to pay Paul, moving one member maybe from your ACA individual marketplace plan to your Medicare Advantage plan. Your overall membership numbers, so don't change with that. Had we been looking at a true blue wave with an expanded House majority, Democrats maybe with 54, 55 members in the Senate, then you might be talking more about a true fee for service type expansion. But I think anything that happens now is going to include the Medicare Advantage as well.
Brian, your white paper is all about policy implications for different sectors of the industry, but you do call out one company in particular, HCA, and say that they're at a lot of risk in the Biden era. Why'd you pick on them, and what's your current thinking?
Not so much picking on them as using them as the best example. I think the largest hospital provider out there, that any sort of move towards Medicare rates is going to be negative for providers. I think by and large, as we just discussed, managed care probably will be fine either way. And in fact, you might see Democrats look to put more money into the ACA reinsurance pools and expand subsidies, things they would back. Providers, however, anything that moves the needle away from commercial rates towards more Medicare, Medicaid rates could be problematic. And in addition to this, you now have states facing the double whammy of, greater unemployment rates because of the COVID pandemic, and lower tax revenues coming in. So they've got higher numbers of people enrolling in Medicaid, lower revenues coming in to pay for it. What are they going to do? And one of the first things they can do is try and get, I guess in their words, creative, which means lower rates for providers. Maybe a Netflix type model for prescription drugs, a subscription-based program, but things that probably won't add money to their bottom lines. And so again, that's the market caps or the providers are the ones that are going to see, I think, maybe a bit more problems. The other thing that Congress sort of inserted into the year-end budget package was the so-called surprise billing fix. That now gets kicked to the Biden administration to actually write the rules on that. See how that looks, but there's just a lot of uncertainty facing the provider community right now.
Brian, there's a lot of change going on in the world as we sit here on the afternoon of January 6th. The Senate races, the second one anyway in Georgia, hasn't been called, and the peaceful transition of power is under some level of threat. We'll see just how much. I hope by the time this airs tomorrow morning. What are you going to be watching for over the next few weeks as things unfold, since not everything is set right now?
Well, a few things, and you're right. We certainly hope that everything works out fine. I would say that we're still waiting for a couple of key appointments from the Biden administration. And again, with presumably the 2 seats going to the Democrats, that maybe gives him a marginally greater flexibility to maybe appoint someone, if he so desires, someone a bit more progressive in terms of running CMS and the FDA. You feel like that they, even on a party line vote, they could now get anyone they really want confirmed, by the Senate for those positions, rather than facing a 52-48 deficit and Mitch McConnell sort of calling the shots on those things. So looking for who he's going to name for the rest of his healthcare team there. And then to see, I think there's a lot of talk about the Democrats using this budget reconciliation process, the same thing that Republicans used in 2017 to pass their tax reform bill. What are going to be the priorities for the Democrats? We've been talking about healthcare. Is it going to be healthcare? Do they want to focus entirely on, another round of stimulus, for the pandemic? Are there other issues outside of healthcare? So there's only, one, maybe two of those so-called silver bullets available each year. Republicans tried successfully in 2017 with tax reform, unsuccessfully when they tried to repeal and replace the ACA. So it's just, Schumer and Pelosi kind of deciding we don't want to have a flop like Republicans did where you try and fail. So what do we feel comfortable and confident about moving forward? So that's going to be what I'm looking forward to later this month, sort of getting a feel for what the priorities are going to be for Schumer and Pelosi.
Yeah, that sounds good. Brian, I've really enjoyed reading your white paper and having this discussion today. Where do people access your research? Who's eligible to be able to see it?
Yeah, our research is available to all subscribers of the Bloomberg Terminal. You can find it if you have a Bloomberg subscription on BI Go.
Great. Well, Brian, thank you very much for speaking with me today, and let's see where it goes from here.
My pleasure. Thanks again for having me.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.